7 reasons why the holidays increase your risk of heart attack. It's not just stress.
For many people, the holidays are about spending time with loved ones, reflecting on the year that has passed, and preparing for the year ahead.
While the holiday season is frequently a time of happiness, researchers for years have noticed a spike in the number
of heart attacks and strokes during the winter holiday season.
So why do the winter holidays increase our risk of disease, and more importantly,
what can we do to reverse that trend? Well, let's start with the why. 1. Emotional stress.
Let's be honest, folks, for most people the holidays are a pretty stressful time.
The stresses can range from simple matters like finding the perfect presents.
For everyone on your list are major stressors like bereavement and recent family loss.
Regardless of the source, stress is stress, and all stress produces a similar physiologic response.
Namely the release of the so-called stress hormones, cortisol, adrenaline, and norepinephrine. Among the many physical effects of these stress hormones is an increase in blood pressure and heart rate. Both of these increase the risk of heart attack, heart failure, and stroke.
Increased physical exertion. The hustle and bustle of the holidays can feel never-ending, from shopping trips to extra chores, to lifting packages, and decking the halls.
Much like emotional stress, this increased physical stress results in the production of those same stress hormones,
which increases the risk of heart attack, heart disease, and stroke. 3. Unhealthy food, high salt, fat, and cholesterol.
A huge part of enjoying holiday cheer involves a good meal or 2 or 5. And frequently those meals include a lot of unhealthy, fatty. These unhealthy foods increase blood pressure and blood sugar,
which leads to more heart attacks, heart disease, and strokes.
4. Overeating.
To add insult to injury, not only do we eat unhealthy foods but we eat way too much of them.
When we fill our stomachs to the brim, the body has to divert extra blood from vital organs, heart and brain, to the stomach just to digest all of the food that we have eaten. The decreased blood flow to these organs once again increases the risk of heart attack and stroke.
Excessive alcohol consumption. The key word here is excessive.
While most folks find a little extra holiday cheer at the bottom of a wine glass, you have to remember that moderation is best, even during the holidays.
Excessive alcohol intake increases blood pressure, which, say it with me, increases the risk of heart attack, heart failure, and stroke.
The American Heart Association recommends that women should limit alcohol intake to no more than
1 drink per day and men to no more than 2 drinks per day. Cold weather. For many of us, the winter holiday season brings a lot of snow and brutally cold weather with it. The body's natural response to cold weather is vasoconstriction, the blood vessels constrict.
This is why your fingers and nail beds turn blue in cold weather, there is just less blood flowing to them. Vasoconstriction also means that vital organs like your heart and brain are getting less